EPG is a disease and medicines knowledge base for European doctors. The service contains more than 110,000 pages of clinical content arranged around 50 major disease topic areas. As a user, I'm able to browse content on the site based on its category. So, for example, guidelines for treatment, organised by disease area, drug data. In my area of practice, I'm in the United Kingdom. For example, we can access within the site drug information in 9 different European languages. I'm also able to access journal abstracts organised by disease topic, year of publication, and I can very quickly gain access to the type of content that I'm looking for. The principle behind the site is to provide doctors with somewhere to start their online journey, not necessarily a web service that answers every question they could possibly have, but to give them easy access to the type of content that they most typically wish to seek online. Perhaps the most innovative element of EPG is the organisation of content around the 50 major disease topic areas. So if we imagine for a moment that I'm a rheumatologist, I can go to the rheumatology disease topic homepage and find within this one part of the site a range of content from educational modules on common and rare conditions through to EULAR webcast or webcasts of recent symposia. I also have access to the drugs relevant to rheumatological disorders, along with drug news written specifically for my area of scientific interest, so content written for me. I can access the latest social media conversations from around the web. So these are conversations that are drawn from platforms, forums, discussion groups and social media websites populated by my peers, members of my profession who are working in the same field. I can also access the latest guidelines for treatment, multimedia, clinical trial outcomes, journal abstracts and related apps. So essentially an amalgamation of all of the most relevant content to me in a single place. As a primary care physician, I may choose to visit the all topics area, so a combined page designed for me as a PCP, delivering a mix of content from all disease areas. But looking to solve a particular problem as a physician, I may simply choose to use the EPG search facility. I can type in a particular condition, click on search, and the EPG databases will serve results to me based on the disease topic, the search term I've used, and categorized to provide me with very rapid access to the type of content that I'm looking for. So if I want to look at the guidelines, I can go straight to the guidelines. If I want to look at disease education, I can do that. Likewise, I can find drugs very quickly for my patient. If I wish to, I can browse all of the drugs available in my particular geographic region as prescription products and very easily gain access to the type of information that I would need to make an appropriate prescription for my patient. Should I wish to do so, I can of course always go back to my disease topic homepage and simply browse the current best practice thinking in my disease area.